get into the COVID rules for the military as they're beginning to roll out. We have some new information here from the Army, and they are saying that soldiers who refuse to get the COVID-19 vaccine and have not requested an exemption will no longer be allowed to re-enlist or be promoted, effectively ending their careers. And the new directive applies to active duty troops as well as reservists and National Guardsmen, as including those serving in states whose governors do not require the vaccine. I'm interested in how this will all play out between the National Guard and the Pentagon, because it seems like the state governor should have say over that, although maybe the Pentagon will leverage funding or something like that to get all these states in line. That's kind of the way I imagine that, this ends up shaking out. But it is interesting that, this is what the Army is saying, how they're going to handle it. I did kind of imagine that they wouldn't fire everyone first, as some people were suggesting, or maybe give people discharges, but rather just not let them sign back up. This is a better situation, I guess, although still, I think, very questionable decision making. The Marine Corps won't expel all unvaccinated Marines en masse after they miss the deadline, which is today. 91% of Marines are vaccinated with at least one shot, with 94% fully vaccinated. It's kind of interesting. It seems the Army has been taking a very "you have to get vaccinated or you will be punished" approach, while the Secretary of the Navy, Carlos del Toro, seemed to try to take a very friendly or conciliatory approach, saying we will be addressing each case on a case-by-case basis. We're just not going to kick them all out on the deadline itself. The Navy talks about that they are going to treat unvaccinated Marines in a very respectful manner and work with them so they understand the consequences of refusing the vaccine. So again, I think the Army and the Marine policy, as far as I could tell, is actually going to be kind of similar, where there's going to be a couple of times where they come and they say, hey, you should really take the vaccine. Then they're going to issue like official, you need to take this order situation, and if you don't, there's going to, I think, be like some counseling. I don't know if this means with your unit's medic or with a therapist or with a actual doctor, like your physician. Somebody, I guess, is going to give you something along the lines of, hey, why don't you want the vaccine? Let's sit down and talk to it and see what we could work out. That's what Del Toro says. We're trying to find out what their problem and hold up in getting the vaccine is. Try to counsel them the best we can offer to an opportunity to change their mind in regards to the vaccination. Hopefully they'll get the vaccination at that point in time. And if they don't, obviously, then they're not going to be able to continue servicing in the Marine Corps. But again, the tone of it is much more, I think, let's try to work something out, rather than, you're not going to be promoted and get the hell out. Now, this article also lays out just some updates on the vaccination numbers in other branches. The Navy is 96.7% with one shot and 99.7% with two or fully vaccinated. They say that, let's see, 6 medical exemptions have been given by the Navy and no religious exemptions. 800 airmen and 1,000 guardians, those are members of the Space Force, are currently unvaccinated. The Air Force has given out, it seems, over 1,600 exemptions. And the Army is 91% vaccinated with at least one shot, or fully vaccinated with only one medical exemption given. I'm not sure. Maybe there's more people who have applied for exemptions and they haven't rejected or passed. They really just have only passed a very few. But it's interesting that the Air Force is given so many more exemptions than the other branches. The Army issued its rules on how it's actually going to handle unvaccinated soldiers while they're unvaccinated. They say that only absolutely mission critical travel will be allowed, and they'll have to submit negative COVID-19 tests weekly before entering Army facilities. So one of the interesting things about this is the test will have to be provided through the unit, I believe, at that level, and they will not be able to buy the kits. Commanders cannot procure COVID-19 kits from medical treatment facilities and must purchase test kits using unit operating funds through the Army's Global Combat Support System. And it says there's only 3, tests that they could possibly buy. But one of the things, the reason I thought that this part was interesting is I wonder if it's going to hurt maybe any units at a budgetary level because it has to use the unit's operating funds to buy these tests. And maybe this is a social pressure kind of way, by you not getting vaccinated, we have to spend $1,000 a month on tests or whatever it is, and for that reason, you have to get you get more pressure from the guys serving in your unit, your friends, than just the military command in general. Seeing they're trying to make you hurt the people around you, or at least that's the way they're trying to make it come out. So this is an op-ed from The Hill, but I think it presents a very interesting challenge to the COVID vaccine mandate, and maybe the most powerful one so far. And that is the defense industry is warning that they are going to lose thousands of employees and have supply chain issues potentially with the F-35 and Columbia-class submarines because of the vaccine mandate. Raytheon is warning that they could lose several thousand employees. Testron has said that the vaccine mandate has not been well received, and they're ready to lose a sizable portion of their employees. This has gone to the point of Huntington Ingalls actually saying that they're just not going to enforce the vaccine mandate. And Google, which isn't always thought of as the biggest defense contractor, but obviously since they're getting the cloud computing contract, and if you look at Project Maven, there's over 600 employees there who have signed an open letter against the vaccine mandate, and actually I think says that hey, if you don't want to get vaccinated, don't let this mandate bully you in to taking the mandate. And so, defense contractors standing up are kind of an interesting group, not exactly people who you would think would be fighting against the central state, but they're worried about losing very quality and hard to replace employees, and so they're trying to get the Biden administration to kill it. Now, they're in an interesting position because they're not a part of the OSHA mandate, the private contractor mandate, although for whatever reason, Google falls under that one, but Raytheon doesn't. But anyways, the Raytheon, Lockheed Martin stuff, they don't fall under that one. They also don't fall under the Pentagon one. They fall under the federal worker one, which doesn't allow a mask exemption or you could wear a mask and get tested in exchange for instead of getting the vaccine. And apparently defense contractors are asking the Biden administration to carve out some kind of exemption for masks and testing, rather than making everybody get vaccinated, because some of their employees just aren't going to do it. The Minnesota National Guard is going to take, I think, $50 billion and send 400 guardsmen to train as certified nursing assistants and temporary nursing aides in order to provide help to the understaffed nursing home facilities. I don't know. This is an interesting thing. In one sense, the National Guard is there to help in times of need, and if there are old people who can't physically take care of themselves anymore, they need somebody to help them take care of themselves or else they'll die, then these are people in need. At the same time, I'm pretty sure nobody who signed up for the National Guard ever thought that they would be changing adult diapers. And I think you increase cases of, possibility of abuse a little bit when you put people in a position where they're doing like working with people in nursing homes and they really don't want to. Not exactly even like, some soldier's gonna haul off and punch some old guy in the face, but neglect and stuff like that happens. And I don't know, it seems like the kind of job that you should probably sign up for, and not just that you should have to go to because you joined the National Guard. That being said, maybe the people who sign up or something will want the certified nursing certificate or something like that, see it as a cheap way to get that certification, and could go ahead. And also, if they need a lot of certification, seems like they won't be able to fill the staffing shortages anytime soon. The CDC has officially expanded and recommended that every adult in the United States get a booster 6 months after they already they got their first doses, or a single dose if you got the Johnson & Johnson, and it is either the Pfizer or the Moderna. Not sure or if any status on the Johnson & Johnson, if they're looking to do a booster or anything like that, but so far it seems like no matter what original shot you got, at least of the three, I know that there are quite a number of people in the US who are involved in tests for other vaccines, and so are kind of in a limbo state. But if you took Pfizer, Moderna, or Johnson & Johnson, then they are now telling you, the CDC, not, I guess, saying that you have to, but recommending that if you are over 18, to go ahead and get the booster shot. Not sure, what all the numbers are, what they're saying, how much is going to help or anything like that. As always, I'm not a doctor. You should talk to your doctor if you have questions about taking the vaccine. If you don't want to take it, if you do, you should probably talk to them and see what's going on, and what's with your own personal health issues. All right. Interesting story here from the Washington Post. Actually, it's really the interesting thing is the Pete Buttigieg interview with Todd, where the transportation secretary, Mayor Pete, tells Todd that, with the way the science works, with what they believe is the case in the White House, that people do not need a vaccine mandate to travel on the planes. It just really doesn't change safety or the spread of the vaccine. I have no idea if that's true or not. That's just what the transportation secretary said. What I found really interesting was the way that Todd pushed back against this. Two things that he said. One is saying that if he was worried about the U.S. Adopting a policy that was politically divisive, and I think actually suggesting that not having a mandate to be vaccinated to get on a plane was politically divisive, and that the Biden administration should worry about that, which is a questionable way to look at. But I think the more disturbing one was Todd saying, if we are trying to get to the end of this pandemic, continuing to have sort of loopholes to avoid a vaccine seems to elongate the pandemic. And there's a lot of falsehoods baked into that and problems baked into that. But the main one is that, Todd has Pete Buttigieg there, right? And his issue with them not mandating vaccines to get on planes isn't that, I talked to this expert who said that actually unvaccinated people on planes are 10 times more likely to spread it, or anything remotely like that. Masking, if you're unvaccinated, masking is in fact, there's a thousand things that I'm sure that they could have come up with, some experts saying, to question the actual evidence of, are unvaccinated people as safe on planes as vaccinated people, right? But that's not what Todd was attacking. He was saying that if you give people loopholes, so Pete Buttigieg is saying that flying is just as safe if you're vaccinated or not. Todd isn't disputing that. He is saying that the fact that you are, not restricting people's travel for being unvaccinated allows for people to continue to be unvaccinated, and that's a problem, right? Which it goes to my real problem with the media coverage of COVID, which is they are distinctly trying, and they'll openly say this, to get everybody to take the vaccine. And look, if the numbers really back people taking the vaccine, then you just talk about the numbers. But like the media has even said, that's a problem that like Fox News hosts aren't telling their followers or viewers to get vaccinated. They openly say the goal is for everybody to, they're just trying to push people to get vaccinated, not just to talk about what's actually happening. And again, it would be, I think, different if they're saying like, look, we're just talking about the truth and this is what the truth happens to be. But here again, I think you see Todd really exposing the truth of what they're doing, which is just trying to bully everybody to get a vaccine and vaccine. And, it really not being if this activity is safe for being vaccinated or not, just merely if you can engage in that activity without a vaccine, it allows you to enjoy life a little bit without a vaccine. And Chuck Todd sees that as a problem. Now, the other thing is the idea that people keep putting out there that if everybody was vaccinated, that there would be no pandemic. And I don't really see anything that suggests that that's actually the case. And I think it's kind of a dangerous lie to tell people if it's not true. One, if everybody does get vaccinated and then people are still getting and dying from COVID, which vaccinated people are, it is happening, then don't you destroy all of your credibility? And, also, even now, like, the plan isn't to have everybody on the planet vaccinated by the end of 2021. They're still not like allowing I think in South Africa, they're like trying their best to copy the Moderna vaccine because they can't get the recipe for it, right? So it's not like everybody on the planet's, about to be vaccinated or something. There's just a few people holding out, but there's vaccines everywhere. And it's just not the case that like COVID will magically go away once every person in the United States has taken 2, 3, 4, whatever, however many doses of Pfizer, Moderna, or Johnson & Johnson. That it's just nothing that anyone is saying is actually saying that's the case. In fact, Dr. Fauci is starting to say things like we're going to have to learn to live with COVID and all this. So, I mean, there's just so many dangerous and false things in what Todd is saying there, and I think it's really important. Couple more stories I want to run through real quick. Los Angeles Public Schools is saying that if kids over 12 are not fully vaccinated, I think you have to have one vaccine in the coming week here, and then 2 by the start of, or fully vaccinated, so maybe 1 of the Johnson & Johnson by the start of their second semester in September, or they will not be able to attend in-person school. This is really concerning, especially with the risk of COVID and kids being so low. As terrible as schools are, and as much as, I think there are advantages to, more parents choosing homeschooling, I think putting more kids on remote learning isn't going to help them and push them further behind academically and socially, isolate the kids that don't have the vaccines. And again, there's just I've seen some studies that say in places where they chose not to do these kind of things in schools, they've had similar results. And again, I don't want to get into all the science here and get myself, or get into all the numbers here and get myself in trouble with YouTube. I just want to, talk strictly about the news and this being the plan for the LA public schools. All right, in Long Island, this reported by the New York Times, a ER has closed because of staffing shortages caused by the COVID pandemic. Man, I just don't get it. In one sense, they're screaming that the hospitals are overrun by unvaccinated people, and then the other, they're firing the unvaccinated nurses and closing ERs. And actually, we had in Massachusetts, the governor ordering some hospitals, because of staffing shortages, to start canceling non-essential procedures. And you could say all you want is a procedure is not essential unless it's yours, and then it probably feels pretty essential. Also saw that the state of New York issued a state of emergency in response to the new Omicron variant, which I don't know anything about yet, so I'm not going to talk about it on the show yet. But even though there's really no evidence that it's like, at this point, worse than anything else, or any particular reason that this would cause a particular problem. Fauci has said that it's different and may evade immunity, but at least the cases that have been documented so far in South Africa, the people have been typical COVID symptoms, and not like anything crazy like Ebola or a very worse virus or anything like that. And so it seems very early for New York to do that, but canceling non-essential surgeries, you do have to wonder if that could also in New York be a part of helping to alleviate staffing shortages. The U.S. says that 90% of federal workers are vaccinated. 5% are seeking exemptions, leaving about 175,000 workers in a limbo state. And I think, kind of like the military, they're going to start with pushing counseling before actually firing people. Last story on today's show, the Department of Justice is pushing the courts to reinstate Biden's vaccination policy for private business. This is the OSHA rule. I believe it's in the Sixth Circuit Court of Appeals now, and currently they're not supposed to be putting it in place, and I think OSHA has halted. I don't know how this court battle is going to play out, but it's really important to a lot of people, so I'm sure people are paying attention to it. I'll continue to follow the trial and provide any breakdowns where I can, anytime I think I could get into the legal details and talk about it in a way that's helpful. But anyways, that's what I have for the show today. Please, everybody,